Okay, so this is chapter 15, day 8, and this was a previous lesson that was given on September 21st on Monday. We have been talking about standard precautions. Earlier, we talked about how you need to wear gloves when you may come into contact with any bodily fluids, and then we also talked about the need of hand washing and the importance of hand washing. So just again, to review, standard precautions must be used in any situation where a healthcare provider may have contact with blood or any fluid that may contain blood. Several body fluids are listed: secretions and excretions, mucus, sputum, saliva, cerebrospinal fluid, urine, feces, peritoneal fluid, semen, vaginal secretions. So lots of different fluids there. Mucous membranes, and non-intact skin. So you need to use standard precautions at all times. Standard precautions are always used in the healthcare field, and also tissues and cell specimens. So another part of standard precautions is gowns. Gowns can be worn during any procedure that may cause any splashing or spraying of blood, body fluid, secretions, or excretions. It helps to prevent contamination of clothing or uniforms. Now, if someone does happen to get blood or any bodily fluid on their uniform, it should get changed if they were not wearing a gown at the time. Contaminated gowns must be handled according to the agency policy and local state laws. If you're going into a room that you need to wear a gown, there's usually gowns right by the door, either before you enter the room or as you leave the room. And then also you're going to remove the gown before you leave the room also. And you need to wash your hands immediately after removing your gown. They should only be worn once and then discarded, and they should not be worn out of the patient's room or care area. So like I said, you need to take your gown off before you leave the patient's room. And also the importance of washing your hands after removing. Also, when you wear gowns, as you can see on the picture on the screen, that his gloves cover the cuffs of his gown, and that's important. You also want to make sure that happens so that you don't have any skin that shows there. So when you remove your gown, you're going to unfasten your ties first, and then you're going to work it off from your arms. And as you take it off, you're going to fold it into each other so that the contaminated part is on the inside, and then you're going to roll it up and discard it into the trash can. And it's also important that you just place it into the trash can and then that you're not throwing it into the trash can. Mask and eye protection is also used during any procedures that may produce splashes or sprays of blood, bodily fluids, secretions, or excretions. Examples of the procedures could include irrigation of wounds, and that's when somebody has a wound and it has to be cleaned, and so it's cleaned with sterile water. Suctioning, dental procedures, delivery of a baby, and any surgical procedures. The mask and eye protection helps to prevent exposure of the mucous membranes of the mouth, nose, and eyes to any pathogen. So it helps to cover up those open mucous membranes. Mask must only be used once and then discarded. If it is a reusable mask, and this is kind of all before pre-COVID, people in the hospitals, their healthcare workers would use disposable masks. They should be changed every 30 minutes or anytime they become wet. So if a disposable mask becomes wet, it should be discarded. And you remove it by grasping the ties or the elastic strap. And you want to make sure you do that because the outside of the mask is contaminated. Masks should not be worn out of a patient's room or care areas and should not be left dangling around the neck. So just like your gown, before leaving a patient's room, you're going to remove it. And again, hands need to be washed after removing the mask. Protective eyewear or face shields protects the front, top, bottom, and sides of the eye. So if you just have regular prescription glasses, that is not included in part of the protective eyewear, because in most regular glasses, there's space in between the eye glass frame and your eyes. If eyewear is not disposable, it must be cleaned and disinfected before it is reused. How you put on a gown. The order which you're going to put on your gown, and this is something that we'll go over later on more. Sharps. Extreme care must be taken while handling sharp objects and to avoid accidental cuts and punctures. Whenever possible, safer needles or needleless devices must be used. So in this case, you want to be able to, hopefully the facility provides needles that have guards on them after they're used, or they retract back into a tube, or the needleless devices, which is when you use a syringe to put medicine into maybe their IV or a port that a person has. Dispose of needles after use, so they have to go right into the sharps container. You don't want to put them down onto the bedside table or onto somebody's bed, because that's when accidents can happen. And with the needles, you want to make sure the needle is not broken off and or bend it. And it needs to be left uncapped and attached to the syringe. So you do not put the cap back onto the needle. If you try to put the cap back onto the needle, that's when something could happen and you may get a needle stick. And it needs to be placed into leak-proof, puncture-resistant sharps containers. In our classroom, we have 3 different sharps containers that are on top of one of the silver cabinets against the wall. Many hospitals, they have them on the wall, and sometimes you'll even go into a public bathroom and they could have sharps containers on the wall there also. All sharps containers must be labeled with a red biohazard symbol, and their surgical blades, razors, or any other sharps are discarded into the sharps container. It must not be emptied or reused, so healthcare facilities actually call companies who will come and pick up the sharps containers, and they are supposed to dispose of them properly. Now, about in 2007, there were sharps containers that were found in the Shiawassee County River. And unfortunately, it wasn't just 1 or 2 sharps containers, but they actually found 50 sharps containers in the Shiawassee River, which was really sad. A company had been dumping them there, and they were able to look at some numbers or some codes that were on the sharps containers and trace it back to where they came from. And in my opinion, unfortunately, there wasn't too much of a consequence for the company. They were just told not to do it again. So obviously, sharps containers do not belong in the Shiawassee River or any other river, or even like in the woods. They do have to be disposed of properly. So like I said, they have to be legally disposed of. Spills or splashes of blood, body fluids, secretions, or excretions. They must be wiped up immediately. So when something is seen, it needs to be wiped up. It can't be left there or walk around it. And gloves must be worn while wiping up the area with a disposable cleaning cloth. So again, you're wearing gloves because you're going to be touching a bodily fluid. And then you also want to use the disposable cleaning cloth. So after it's all cleaned up, then it gets thrown away. And it doesn't get thrown away into the regular trash can. It gets thrown away into the biohazardous trash. It also has to be cleaned with a disinfectant solution, such as a 10% bleach solution, to make sure everything is killed or prevented from growing there, and everything is wiped up properly. For a large spill, an absorbent powder may be used to soak up fluid and then swept up and placed in a biohazardous container. So this is going to be a lot like when in school, when someone vomits, they'll come in and put this powder on the vomit and then they sweep it up. So it's the same concept that they would use in a healthcare facility. Resuscitation devices. Mouthpieces or resuscitation devices should be used to avoid the need for mouth-to-mouth resuscitation. When you take CPR in the class, then you will receive your own resuscitation device. And the part on the bottom part of it there in the picture is disposable, but that part on the top where it looks like there's some yellow in it, the part on the bottom where the strap is, that you can reuse. It can be washed and reused again. But the part on the top where it looks like it's kind of yellow, now that has to be disposable after it's used, because it's got a one-way filter in there, and so once it's been used, it's contaminated and you're not able to clean it. That part gets thrown away. All resuscitation devices should be placed in convenient locations and are readily accessible to anybody working in that healthcare facility. And if not disposable, they must be disinfected between patient use. Waste and linen disposal. Again, you're going to wear gloves. And why do you wear gloves? Because you could come into contact with bodily fluids. You want to follow your agency policy, which is also according to the law. Infectious waste includes contaminated dressings, gloves, urinary drainage bags, incontinence pads, vaginal pads, disposable emesis basins, bedpans or urinals, and body tissues must be placed in specific infectious waste or biohazardous material bags. So it's going to be in those red bags that have that biohazardous symbol and the word biohazard on it. Other trash is frequently placed in plastic bags and then incinerated. And again, all the waste must be disposed of properly in the proper container. The soiled linens should be placed in a laundry bag to prevent any contamination. And linen soiled with blood and body fluids is placed in a special bag for contaminated linen and is usually soaked in a disinfectant prior to being laundered. So there in a picture is what a soiled linen container may look like in a hospital, and it has a biohazard. So any linens that could be contaminated would be put into there. Others may have 2 linen containers like that, and one might have a red biohazardous bag. So it's going to depend on the facility that you're at. And again, of course, you need to wear gloves because you can be handling contaminated linens. And any bag containing contaminated linens must be clearly labeled and color-coded. Any cut, injury, needle stick, or splashing of blood or body fluids must be reported immediately. That's the key here, is it needs to be reported immediately. You're not to wait until your shift is over. You're not to wait until your task is completed. You're to report it immediately. Now, if you were to have something splash under your eyes, then you would want to rinse them out and at the eye wash, and then you would report it. And you would call a fellow coworker to help you or to finish up what you were doing so that you would be able to leave and to wash your hands or to wash your eyes and then to go report it to your supervisor. Again, the agency policy must always be followed. All healthcare facilities must have a policy for when contamination or injury occurs. States the actions that have to be taken immediately after exposure or injury. So it's going to tell the supervisor all steps that have to be taken after an exposure. First, the injury has to be reported. The document exposure injury incident, so it has to be written down and documented what occurred. And then it also has to record what care was given to that employee and any follow-up care that was given also. And it needs to identify ways to prevent a similar incident from happening again. So with someone careless, if that was the case, what needs to be done so that people aren't careless. There's more training need to be occurred for everybody. Or maybe they find that one particular needle tends more people have more injuries with this needle. Do they need to stop using that type, or does more education need to be given on how to use the needle? Standard precautions must be followed at all times by all healthcare workers. By observing standard precautions, healthcare workers can help break the chain of infection and protect themselves, their patients, and all individuals. Now, of course, following standard precautions does not eliminate the risk of possible exposure, but it does decrease that risk greatly. And just so you know, the 15.2 bioterrorism workbook pages are required. Also, the 15.4 workbook pages are also required. So this is work time that the students had in class in between. Now we can talk about sterilizing with an autoclave. The autoclave is the safest, most efficient sterilization method that is used. An autoclave is a piece of equipment that uses steam under pressure or gas to sterilize equipment and supplies. It will destroy all microorganisms, both pathogenic and non-pathogenic, including spores and viruses. So remember we talked about that antiseptic, we talked about chemical disinfection or disinfection, we talked about sterilizing. Sterilizing kills all microorganisms, both pathogenic and the non-pathogenic. So remember, the pathogenic ones are the ones that make you sick, and the non-pathogenic ones are microorganisms that do not make us sick. So sterilizing with the autoclave will kill all of those microorganisms, even those that have spores and the viruses. And the viruses, remember, are the harder ones to kill. They're available in various sizes and shapes. Offices and healthcare clinics may have smaller units, and then the hospitals will have much larger units. And at home, if you want to sterilize something, you can use a pressure cooker. Before any equipment or supplies are sterilized in an autoclave, they must be properly prepared properly. All items must be washed thoroughly and then rinsed. So kind of think of it like the dishwasher. Do your parents require you to rinse your dishes before putting them in the dishwasher? I know for me, I don't use my dishwasher very much because I feel like I'm washing my dishes and then I put them in the dishwasher to be washed again. So you have to pre-rinse, put your dishes in the dishwasher, and just like the autoclave, you also have to pre-rinse and get off and wash the supplies before putting them into the autoclave. Oily substances on any of the instruments can often be removed with alcohol or ether to get that off before getting them put into the autoclave. Any residue left on articles will tend to bake and stick to the article during the autoclaving process. So again, back to the dishwasher, if you ever pull out a plate or a bowl that has some stuck-on, baked-on food on there, after going in the dishwasher, it's a lot harder to get off. And it's going to be the same with any instruments or articles that may have some residue left on them before going into the autoclave. Items that are to remain sterile must be wrapped before they are autoclaved in order to keep them to be sterile. Here is a video, and I'm not going to show the video now just because I found that the what they say on the video does not show up during this recording. So I would definitely encourage you to go back to the Google Classroom and go to the Chapter 15, Day 8 slides and watch that video, and it explains to you more about what autoclaving is. The autoclave must be loaded correctly for all parts of an article to be sterilized. Must be space between all items. So again, just like the dishwasher, if you've ever gotten in trouble for overloading the dishwasher, if you put bowls into the dishwasher and they're all stacked on top of each other, they're not going to get clean. Or if you have a bunch of plates together, that are very close together, again, those are not going to get cleaned also. So it's going to be the same in the autoclave. When putting instruments in there or articles in there, you have to make sure there's space in between everything so that that steam can get all around that piece of equipment. No article should come in contact with the sides, top, or door of the autoclave. If that's the case, then they will not be sterile. Sterilized items must be stored in a clean, dust-proof area after leaving the autoclave. And items usually remain sterile for 30 days after autoclaving. So once they come out of the autoclave, they're wrapped up. They may have some tape on them to keep them wrapped up. And those who work in that area, in that department, will put on the date as to when they were sterile. So when somebody goes to grab that sterile packet, then they're going to look at the date to make sure it's within 30 days. If it's past the 30 days, they will not use it, and it'll have to go back into the autoclave to be sterilized again. If the wraps are loosen or tear, if they become wet, or if any chance contamination occurs, the item should be rewrapped and autoclaved. So if it becomes wet, why is it no longer considered sterile? So if you think back to when we were talking about washing our hands, we have to turn off the faucet with a dry paper towel, and that's because pathogens can travel through wet paper towels very easily. So that's why a sterile object must remain dry, because if it's wet, then those pathogens could travel through that wet paper towel. It's also the same case with your mask. That's again why, if it becomes wet, it needs to be changed. Because the pathogens can travel through your wet mask, and you don't want that to happen. They also use chemicals for disinfection. Many healthcare fields require the use of chemicals for aseptic control. Many chemicals do not kill the spores and viruses, though, so therefore chemicals are not a method of sterilization. A few chemicals will kill the spores and viruses, but these chemicals frequently require that instruments be submerged in the chemical for 10 or more hours, which makes it not very efficient, as that area of that they're being soaked in is used up, and then also you're not able to use any of that equipment for 10 hours. Of course, it's essential to read the entire label to determine the effectiveness of a product before using any chemical, and also read the label so that you can use it properly. Chemicals are used to disinfect instruments that do not penetrate body tissue. So this could be dental instruments, percussion hammers, scissors, and similar items are examples. So a percussion hammer, if you know what that is, think about what that could be. So if you've been to the doctors and you're asked to sit on the edge of the bed and they take a little hammer and they hit your knee and then your foot kicks out. So that little hammer is called the percussion hammer. So you want to remember chemicals are used to disinfect instruments that do not penetrate the body tissue. Chemicals are used to disinfect thermometers and other items that would be destroyed by the high heat used in the autoclave. So same thing with the thermometers, those don't penetrate our body, which means they're not cut into our skin. And then also if you put that thermometer into the autoclave, it would be ruined. Same thing with dental instruments. If you think about it, they're used to clean your mouth, to scrape at your teeth, scrape at your gums maybe, but they don't cut into our gums, so they're not. So that's why they can be used. Chemical disinfectant can be used. Proper cleaning of all instruments is essential. Particles or debris on any items may contaminate the chemical and reduce the effectiveness of the chemicals. So what happens with chemical disinfectant to use for instruments? Sometimes there is a glass container full of the chemicals, so you would drop the instruments in there to soak for a certain time period and then pull them out. So if you put, going back to the food on your dishes, if you're washing dishes and there's a lot of food in there, it doesn't seem like it gets in the dishwater, doesn't seem to get your dishes quite as clean. So it's going to be the same thing. You don't want any particles or debris floating around in the chemical solution, because it's going to reduce the effectiveness of the chemicals and won't clean the instruments as they should be. All items must be rinsed because the presence of soap can also reduce the effectiveness of chemicals. And the articles must be dry before being placed in the disinfectant to keep the chemical at its most effective strength. So whenever you're putting any amount of water in with the chemical solution, you're diluting it a bit. So again, you're going to decrease the strength of it and how effective it is. So you have to make sure the articles are dry, make sure they're rinsed of soap before drying them, and then make sure they don't have any debris or little pieces on them. The chemical disinfectant must completely cover the complete article or instrument, and the only way to be sure that all parts of the article is to be disinfected is if the whole thing is covered by the solution. When removing items from the solution, you could use sterile gloves or forceps may be used. Again, you're not going to want to stick your hand in there to pull them out, because remember, disinfection, chemicals for disinfection are usually harsh on your skin. Items should be rinsed with sterile water to remove any remaining chemical solution on it. And after rinsing the instruments, they are placed on a sterile or clean towel to dry, then stored in a drawer or dust-free closet. Solutions must be changed frequently. There are some solutions can be only used once, and then others need to be discarded after one use. So again, you would have to read the instructions of the chemical that's being used so that you know how often it needs to be changed, if you have to change it after one use, or if you can use it a few times. And you want to follow the instructions. Anytime contamination occurs or dirt is present in the solution, you need to discard it. So if you can see, I would say floaties in the chemical solution, that's when it needs to be taken out. So 15 6-work pages are not required to be turned in. They are a good review for you though, and if you want me to, I can check your answers to see how you did with it. So our next section, you want to continue to keep reading on chapter 15. I think that is it for this lesson. So be sure to check out that video in the Google Classroom for the Google Slides for chapter 15, day 8. And if you have any questions, you can always email me or call me or contact me, and I will help you any way that I can. Thank you.